Welcome to History of Retina's Leaders and Legends series. The purpose of these interviews is to capture first-hand stories from individuals with unique retinal insights of historical significance. Through these discussions, we hope to provide a fuller understanding of the evolution of both the science and the practice of retina through the lens of those individuals who have actually lived it. It's a true privilege and honor to welcome Dr. Mark Johnson to Leaders and Legends. Mark is a professor of ophthalmology and visual sciences and chief of the retina service at the Kellogg Eye Center at the University of Michigan. He earned his medical degree from the University of Utah, completed his ophthalmology residency at the University of Michigan, and then went on to train in both medical and surgical retina at the Bascom Palmer Eye Institute. A distinguished clinician, surgeon, and researcher, Mark has helped define our field through pioneering work on macular diseases, the vitreomacular interface, and surgical strategies. His academic contributions are enormous, with nearly 250 publications. He has held numerous key leadership positions within our field, including as president of both Macular Society and Retina Society. His many honors include the U.S. Presidential Scholar Award, the Heat Gutmann Award, and the Gas Medal from the Macular Society and the Gas Award from the Retina Society. Throughout his remarkable career, Mark has been a steady and inspiring force, advancing retina science through keen observership, thoughtful innovation, and unwavering commitment to patient care. All of this while mentoring generations who are now shaping the field worldwide. Please join me in welcoming Dr. Mark Johnson. Mark, it's really, truly an honor to be able to have this conversation today with you. I'd like to start, you grew up really most of your childhood through your early adulthood in Salt Lake City. Tell us a little bit about how that sort of formed you and impacted you growing up.
I grew up in I would say, strongly religious family. And although the religion didn't really stick, a number of aspects of that upbringing did. The first, I think, was the sense that family comes first. And that, I'm sure, was instrumental in shaping my own sense that fatherhood and parenting was my highest priority among everything else that I was doing. The second was there was a strong cultural emphasis on service to others. And the third, I think that upbringing probably accounts for the lifelong interest I've had in what I would call spiritual practices, practices that help us cultivate things like empathy and compassion and gratitude and generosity. And the final thing was I had a great educational experience. I had wonderful teachers who helped me succeed academically. I had a lot of leadership opportunities and discovered that I was quite curious about the world. As an example of that, I received the U.S. Presidential Award as a senior in high school, which was presented at the White House. So my mother and I traveled to D.C., and we got there and immediately went to the Smithsonian museums. And as you know, there are 5 or 6 of them. There are endless number of exhibits. And I told my mom, I want to go through every single exhibit of every museum while we're here. And we started out on this, and after 2 hours we were exhausted, laying on a bench and saying, okay, we're done. But it sort of speaks to the fact that at least at that age I was quite curious and wanted to learn as much as I can about the world.
That's amazing. So in addition to growing up in Salt Lake City, you did have a unique opportunity where for 3 years you lived abroad in Stockholm. How was that experience, and what perspectives did that bring for you?
I was, I think, a bit shy, and one of the experiences we had there, as soon as we got there, we were put into a Swedish school. We didn't know Swedish, we didn't know any of the people, and so that, for a shy person, that was pretty traumatic. But learning that doesn't kill you, and that you make friends and you learn the language and get through that, I think was maybe helpful in overcoming some shyness and building resilience to some extent. And then after a year in this little country Swedish school, we were put in the international school in Stockholm, which was a wonderful experience. I had classmates and friends from every continent around the world, and I think that really gave me an appreciation for the fact that no matter where people come from, they're the same in some ways. They have the same kinds of aspirations, and that I think has been really helpful for me through my life. Also helpful in maybe relating to patients.
When did you really know medicine was your path? Was it in high school? What was it that you found that brought you to medicine?
I think my journey there was probably similar to most of us. I was sort of a top student, or at least I identified as a good student, and my sense for my options when I was a good student was medicine or law, and medicine seemed more exciting. Law seemed a little dull, although I like to make arguments and reasoning and so on. But I think medicine won out because I was interested in science, and it was clear to me that this was a nice way to blend my interest in science with my sense that life was about helping people, or should be about helping people, or at least that's what I wanted my life to be about. So it was kind of a natural fit.
You stayed in Utah for medical school, and they had a tremendous department of ophthalmology there. Did you have an influencer for you during that time that really opened that door? Was it an early decision for you? Tell us a little bit about that.
My father has glaucoma, or had glaucoma, and I got to know his ophthalmologist, a man named Richard Aldis. Really just a wonderful example of a competent, caring physician. That was very impressive to me, and so I became interested in ophthalmology somewhat early on. But then in medical school, I saw myself more on the internist track, internal medicine, thought about cardiology, and that became a difficult decision. And I went back and forth and was into my senior year still debating. At that point, I had a serious conversation with Randy Olson, who was the long-term chair at Utah. He also happened to be a family friend, and he was another very impressive figure, and he sort of helped me make that final decision. And since we were now very late, came up with a list of places I could apply, or that he thought I should apply, and was kind enough to write a letter. As an aside, he was a chair for so long that he last year wrote a letter for my youngest son to go into ophthalmology. So that is amazing. That's how long he's been there.
Yeah, that's really spectacular.
I found myself in a position where I had decided to do ophthalmology after many of the deadlines had passed, including the deadline at Michigan. So I went down this list that Randy Olson had provided, and I called all these programs and said, can I still apply? And some said no. And I called Michigan, which I was kind of interested in, and I have to say I credit much of my professional trajectory now to Paul Lichter's secretary, or administrative assistant, because she said, well, our deadline has passed, but Dr. Lichter is out of town. If I send you this very quickly and you send it right back to me, this is, it was all done by the mail, all analog, filling out a paper form. I'll put it on his desk and he'll be none the wiser. And so that's how I was able to apply to Michigan. So I got an interview and showed up for the interview, and the first person who interviewed me was Alan Sugar, who's for those that don't know him, sort of a severe, very stern, serious kind of person. And he looked at my application, looked at me, looked at my application, and said, I don't know why we're interviewing you. You applied way after our deadline. So I always, when I actually came as a resident, the first thing I did was go to Paul Lichter's administrative assistant and thank her profusely for launching my career.
Yeah, I mean, it's really an incredible story, and one of those things where you just kind of feel like things worked out the way they were supposed to work out. And so you were there for residency at Michigan, and then went to Bascom Palmer for medical and surgical retina. And then you came back, obviously, to Michigan. Did you know when you were leaving residency that you were already planning to come back in faculty? Did you have that academic interest already there?
Yeah, good question. I would say that it gradually became apparent to me during residency that I might end up in an academic spot. I increasingly became interested in writing, and I found that I enjoyed speaking. As it came time to head to Bascom Palmer, again, Paul Lichter, the chair, came to me and said, "I would really like to hire you and have you come back." And I said, "Well, it's a little early. I'd kind of like to be a free agent when the time comes. I'd like to be able to look at what's available and choose what's best for my family." And so I sort of declined the offer. And he came back a few days later and said, "Look, I've already got some money to recruit you, so why don't you just take that? And I know you don't get much as a fellow." And I said, "No, I think that would really make me feel, obligated, and I wouldn't have the freedom I need to make a decision." And so he went away, came back. He's a very persistent man. Came back a few days later and said, "We've already got the money. Why don't you take the money, and if you don't come back, just you can pay it back as a donation to the department." And I felt like that gave me enough freedom. I'm not sure it really did, but it at least gave the illusion of freedom.
It's a brilliant recruitment tool,
Yeah.
and a good way to get a donation for
Right.
the department as well.
Yeah.
So I'd love to hear more also about your time at Bascom Palmer.
I did my first year with Don Gass as his medical fellow, and then I stayed for a second year and did vitreoretinal surgery. I would say the surgical year was pretty standard. Had great mentors. The year with Gass was fantastic. As many people have heard, he has a set of personal characteristics that are quite unique and that allowed him to succeed in a spectacular way. And I would, everyone has heard about this, but he truly was brilliant and had this amazing memory. I think one of the key factors with Dr. Gass is that he was very scientifically humble. He knew what he knew, and he knew what he didn't know. He would say repeatedly to patients, to house officers, to other faculty, he had a strong Southern accent. He'd say, "I have no earthly idea." You'd ask him a question, "I have no earthly idea what that is." And because he knew what he didn't know, and because he was incredibly curious, he spent his life finding things out and describing disease after disease that nobody had figured out before. And he had many other virtues. He was a tireless, hard worker, intensely focused. You could pass him in the hall, he wouldn't even notice you because he was thinking about something. That produced sometimes some problems for him. He was so focused on the science or whatever he was thinking about that he would be a little absent-minded in practical things. He might forget where he parked, or might forget that he drove to the airport.
Who his fellow was?
Yeah, or who his fellow was. So yeah, really an amazing and inspiring example. Certainly, was a person of complete honesty and integrity, and always put patient interests first. I never saw him be influenced by any sort of outside factor other than what was best for the patient in front of him.
Yeah. Any one experience with him stand out for you that was really stuck with you?
I guess one experience that has stayed with me is that I realize now that I may be the only person in the world that's examined Dr. Gass's macula. So he was the father of macular disease, and I was walking down the hall one day, and he said, "Mark," pulled me into a room and said, I'm noticing some metamorphopsia. So, my vision's distorted. Can you please examine my macula?" And I did a very careful examination and told him what I thought he had, and he thanked me and left, and I never heard about it again. In retrospect, I'm quite sure that he had vitreofoveal traction. Was causing I saw some cystoid thickening in the fovea, and he had no other reason to have it. And I suspect that resolved spontaneously, as it often does. But that was kind of a thrill to look at the master of the macula, to look at his macula.
So you finish at Bascom and then start your career at Michigan. As you look at not only your time leading up to it and your time as you continued your career at Michigan, we talked about a couple of people obviously already, but could you identify, 3 to 4 really influencers for you that impacted who you were as a clinician, as your career, that really shaped what you saw as you started out as a practicing retina specialist there at Michigan?
I think the major influencers at Michigan, I would list 2 of them. One would be Paul Lichter. So he was my chair for many for several decades after I joined the faculty, and I learned a lot from him. Not so much about retina, but about leadership, about ethics. He was highly committed to the highest standard of ethics. Would not allow any kind of corporate influence into the eye center. Had become really a scholar of physician-industry relationships and the dangers of those. As a model for leadership, I couldn't ask for a better mentor. Jonathan Trobe would be another person I would list. Again, he's a neuro-ophthalmologist, so not so much in retina, but as a teacher. He was a master teacher, spent his career writing books and developing online, teaching programs, and just a master speaker. And we would have conversations about how to give a good talk, and he would, if when I would give a talk, he would almost always make some kind comments after and talk about what I had done well. He wasn't usually critical, but he would specifically point out, I loved how you did this and this and this, and that sort of, I think, built some confidence in me about my own speaking ability. But largely, I was modeling him. He also had this enormous enthusiasm, a curiosity similar to Gass's, and just a huge enthusiasm for learning, and then sharing what he had learned. So those I think were the 2 main influences.
I'd love to hear more from the research side of maybe 1 to 2 things that you're most proud of, most excited about from a contribution, and maybe how you go about that research thought process.
I would say it's probably true that most of the contributions I've made have started with observations in individual patients, which is really the way Gass operated as well. I mean, that was sort of my model. So, for example, early in my soon after I finished with Gass and came back on the faculty, this was right after Gass had described what he thought was the pathogenesis of idiopathic macular hole, and I was troubled that there was part of it that just didn't quite seem to fit, but I didn't think much of it. I just accepted what he said, and then I came back, and within a couple of years, on the same day, I saw 2 patients with early stage macular hole, and it became apparent during the exam that the vitreous around the hole was separated from the retina, and that it was still attached to the edge of the hole, and that was not what Gass had described. And I said, well, that's interesting. I wonder if that's the rule or the exception. And so I started looking. We didn't have OCT at that time. I started looking at a series of patients with early stage holes with ultrasound and in surgery, and became convinced that in every case, the vitreous was in the process of separating, but was still stuck at the fovea. Now, that's old news now, but at the time, that was a brand new observation. So that led to a paper suggesting that an early stage of PBD was the initiating event in macular hole formation, and then that was confirmed by a similar paper from Paris about the same year, and then I went on and explored all the other things that PBD does in its early phases, and talked about how PBD progresses, and what are its complications, what's the pattern of progression, the time course of progression, and what are the other complications. And that became my AOS thesis. The same thing happened for optic pits, which has been another area of interest. I saw a patient that had optic pit surgery and then ended up with fish egg gas bubbles under the retina, and said that's not supposed to happen. And so that led to a whole exploration of the unusual pressure gradients that exist in optic pit patients that move along the anomalous fluid channels that are there based on the congenital defect, and we tried to come up with a whole theory of optic pit of optic pit maculopathy, and what that says about treatment. Another patient that really stimulated an interesting journey was a patient with acute exudative vitelliform or polymorphous vitelliform maculopathy, who, when I first saw them, thought they were healthy, and then 5 months in, was diagnosed with metastatic melanoma. And we ended up in just trying to figure out how to put those two things together, because that was not a known association at that time. We assayed the patient for autoantibodies and found antibodies to the RPE in that patient. And since then, there have been a number of other papers. So we proposed that AEPVM is an autoimmune retinal pigment epitheliopathy, which is kind of a new category of disease. And now there have been a number of papers showing autoantibodies in patients with that disorder and related vitelliform maculopathies. So again, many of them have started with just individual observations, and then there have been other papers where we look at large series of patients, surgical outcomes, and things like that. But I have to say, I still really get a thrill out of trying to figure out something that nobody knows just from patient observations.
You talked earlier about some of the influence around your youth, particularly around service, empathy. And I know we've talked about some of your interest around compassionomics and how to now sort of a newer area that you're looking at from the research side and bringing that to your practice. I'd love to hear more about that as well.
Yeah, my interest in compassion as it applies to medicine really started with by reading the book called Compassionomics, and this is a sort of a synthesis of the literature on the topic. They analyzed 1,250 papers and abstracts and looked at the effects of compassionate care on patient outcomes, on the quality and safety of healthcare, on healthcare economics, and on the provider. And it was very compelling to me that when a physician provides compassionate care, and we're not always very good at doing that, it measurably changes patient outcomes, both physiologically and psychologically. It improves the quality and safety of care. It enhances financial margins. And importantly, it also has huge benefits to the provider. It's a major antidote to burnout. And as we've all experienced, when we're really there with the patient, when we're present with the patient and thinking about their welfare and intentionally wanting to provide kindness and compassion, it changes our experience. It turns it into an experience of that's infused with joy and satisfaction and connection. And it's not like that if we're in our minds or we're stressed or thinking about something else. So I read this book and realized I'd never heard a discussion of compassion since I'd graduated from training. Never heard a talk on it at one of our meetings, and decided that I could at least try to spread the gospel of compassion within our field. So I ended up writing a perspective piece for AJO, where we're just basically summarizing the book and our own literature search, and then have tried to speak on it when I get a chance. So that's part of my interest is kind of spreading the word, and then in my personal life, it's made me even more committed or more motivated to cultivate empathy and compassion, and then figure out better ways to express it to patients.
I'd like to switch gears again a little bit now and talk about leadership. Your career has been remarkable when you look at what different leadership roles you've had, whether it's been at University of Michigan as the head of the retina service or in the retina community as president, for example, of both the Macular Society and the Retina Society. I'd love for you to share some about that journey and what that experience has been like for you.
When I started my career, I never had the ambition or aspiration to be a leader. And that has been an advantage to me, I think, because I was never disappointed when I wasn't. I was just happily doing my work, and then one by one opportunities came along. But since they did come along, I'm very happy that I took the opportunities, and I've certainly experienced a lot of the joy that leadership can bring us. I think it's a common experience with anyone who's been in a leadership position. And with that comes this sort of wonderful, almost like parental pride as retina section leader. If I come to a meeting like this, every time one of my faculty members gets up and gives a talk, or one of the fellows, I just feel great. I feel that real sense of pride and excitement about their contributions and accomplishments.
You've had a tremendous number of accolades and awards, way too many for us to be able to, run through here. But I would love to hear, are there any that you really hold, dear to your heart that are particularly special that you'd like to share?
I think three are particularly meaningful to me. One is the Heed Gutman Award from the Heed Society. And I think that was special because it's given in recognition of contributions across all of ophthalmology. So it's not just a retina award, as you know. And for many years, I would go to the academy and go to the Heed. There's a luncheon every year. I would go to the luncheon, and they announce the Heed Gutman winner by giving their accomplishments, but not telling the name so it's all very suspenseful. But over the years, I've just had so much admiration for those people. Never dreamed that I might be put in that group. But so that was certainly very meaningful and surprising and unexpected to receive that one. And then the other two are the two GAS awards: the GAS Medal from the Macular Society and the GAS Award and Lecture from the Retina Society. And those are meaningful simply because, to be associated with GAS in any way is meaningful to me. Just a really fun experience to try to do a lecture that paid tribute to GAS in this sense of, coming up with, learning about disease pathogenesis through observing individual patients and groups of patients. And people really seem to enjoy that kind of a lecture because, we forget, we get lost in big data sets, and we all love learning from individual cases and patients.
Wonderful. I can't thank you enough for taking the time to chat today, Mark. It's really been an honor, as I said, to have you here with us for Leaders and Legends.
Thank you, Jess. It's been a real pleasure. It's been fun.